Hello, I am Dr. Radhakrishna. I am a surgical gastroenterologist and a laparoscopic surgeon of over 20 years experience, and I shall talk to you about laparoscopic day surgery, which is a relatively new phenomenon in India. About 65% of the operations in the West are done as a day surgery. Majority of the Western hospitals have an attached day surgery unit where these patients come, get admitted in the morning, undergo surgery, and then leave by evening. But this phenomenon, for some reason, is not so common in India because of various reasons. One, Indians believe that any operation is a huge event and they need to stay in the hospital overnight, and then they need to have visitors with flowers and fruits, etc., and then they have to absolutely become normal, take normal diet, and then go home. But then experience has proved that all these patients can just be home with medical attendants over the phone if necessary, and then just get back to their work very quickly. Now, laparoscopic day surgery is a relatively new phenomenon in India, and we from Chennai have a reasonable experience in this area, so I thought we should say a few words about it. To start with, gallbladder surgery was done by open surgical method for over 400 years. With the advent of laparoscopic surgery about 30 years ago, the surgery has become very simple. So that gallbladder surgery, for that matter, many of the abdominal surgeries can be done by keyhole surgery, where the patient's recovery is so very quick, very little pain, and hardly any scars. But still, these surgeries are done with patients staying in the hospital for a day or two. We thought we should attempt laparoscopic day surgery, and then with an advent of a good day surgery center in Chennai, we started off this, and with a very good dedicated team of nurses who are aware that these patients are going to come in the morning and get back to their homes by afternoon, and excellent anesthetic team who know that they should give the right amount of drugs and the right amount of analgesia, so that the patient will be walking back home painless and not have nausea, vomiting at home. And of course, a very good surgical team who are aware that we should not have any sort of a complication requiring some additional maneuvers and hospital stay. In the last about 1.5 years, we have done over 230 laparoscopic procedures, majority of them gallbladder surgeries. We have done bilateral inguinal hernia, ventral hernias, umbilic hernias, appendicectomies, Heller's cardiomyotomy, fundoplication, esthesiolysis, etc. And the average duration of stay is about 5.5 hours. And then these patients walked into the hospital, got their surgery done, and walked back home without pain. This is because of some special anesthetic maneuvers, and also a technique of anesthesia called tab block. Tab block is giving local anesthetic into the abdominal wall and blocking the nerves which cause pain. And you should believe that these patients have absolutely no pain. We have a pain scoring system where the patient marks the pain, and then when we have seen when they come to see us the following morning, they just be cheerful without pain, and they say that for some strange reason they had no pain at all. And when we see the records, about 90% of them have 0/10 pain score in the last 24 hours. This is strange to believe. Not just that, we didn't have even a single patient who was either readmitted or contacted us for any issue among these 230 cases. Now, we very strongly believe that laparoscopic day surgery is possible, and not just laparoscopic day surgery. Day surgery by definition is less than 24 hours in the Western world. It is less than 6 hours. Patients can come and get their operation done and get back home in 6 hours time is unbelievable. Actually, we are trying to believe this now after we've seen so many patients coming over here for this procedure. Now, it is necessary that we have to carefully select these patients, that they should not have any serious anesthetic or cardiac or any other risk which were anesthesia, and they'll concur with us. And of course, they should have a good social support system at back home so that they can, some relative can take care. So with the experience of over these many cases, I strongly believe that majority of the operations of gallbladder, appendix, hernia, and visualizes, ovarian surgery, etc. can be done as a day procedure with just 6 hours stay and absolutely no pain.